Welcome to the show. Today we're going to talk a lot about workforce development and really kind of answering the question, are we helping get people out of poverty or are we keeping them trapped because we have a fragmented system? So today I'm going to talk to Mary Bentley. She's the co-chair of the Arkansas House Hospital Medicaid and Developmental Disabilities Subcommittee, which is a committee doing a lot of the work on workforce and social services. So Mary, welcome to the program.
Thanks, Mindy. Thanks for having me on today. I really appreciate it. I think this is a very important topic. I'm really excited about our session coming up. I think we're going to get some really good things done, and hope this is one of the things that we accomplish this next session. So thank you so much for the opportunity to be with you today.
Well, you have a big vision. Yeah. No, thanks for being here. You have a big vision, and I look forward to sharing that with people because I think it reframes how we even look at social services and workforce. So let's kind of start at the beginning, maybe some top lines, and then we'll dig down. What made you want to get into this area and decided that it needed a major overhaul to begin with?
Well, our chairman, Les Eads, knows how I've been passionate about Medicaid. I'm a small business owner, and as most of Arkansans, when I send tax dollars to the Capitol, I want them to be used efficiently and effectively. And this is an area that I just really have been frustrated about because as a small business owner, I make sure things are done well and efficiently. And I think somehow we just lose that when it comes to government. So I really was been frustrated. I've been frustrated because I have been blessed to be a legislator for 12 years now, and I see the same families that are in poverty have been in poverty for forever, and I feel like we're spending millions of dollars, but nobody's getting any better. Nobody's any better off. We're not seeing any people moving forward. We're just putting these programs forward, but nobody's really following through to make sure folks are better off. So I love a return on our investment. I think it's really important for Arkansas taxpayers to know that their money has been spent wisely and people's lives are better off. And unfortunately, this is not what's happening here. So we had in the 2025 session, I'll just start with that, we had a great piece of legislation passed by Senator Justin Boyd to just take a deep dive. He assigned it to our subcommittee that Senator English and I are co-chairs of an ALC, and they just wanted us to take these 2 years, which we've been doing for 2 years, just do a deep dive. What in the world's going on with social services here in our state, and what's going on with workforce, and are people better off, and where are we spending money, and what's going on? So it was a big assignment, but I was really excited to have the opportunity to do it, to have a structure and way to do it, and a way to get some things done. So I've been asking these questions in my mind for a while, but as you know, it's kind of hard to really, we're citizen legislators. We can't always get everything done that we want to, but this has really been a great opportunity to me, and I'm passionate about really making a difference in our state. So I can sure keep going on from what, so
No, I
we,
think that's great. And
yeah.
so I think it's really important that we also remind listeners that this is more than a paycheck, right? When we talk about these social services, there are social, emotional, family benefits that are going into this, that it's not just a government handout, right?
Right.
It's something, it's more encapsulating than that when you talk about this workforce. Is that right?
Sure. I mean, there's like 80 different programs out there that are just, somebody's doing one thing's doing another. Like popcorn, just doesn't matter. Whichever, some counties do something, some counties do another thing else. It's just really hit and miss, and who knows? Maybe you might get somebody that really knows what they're talking about to help you out. But it's really been very fragmented all over and it's very frustrating when we're duplicating things and the same people being seen by 5 different people. It's just very, very inefficient and ineffective. So that's really what I'm excited about this committee, is like really do a deep dive and just do it. We had our subcommittee hired a consultant to do some auditing to see just complete thorough overview of what's going on. They came and did on-site visits to see what was going on in our workforce system, what's going on in DHS, what's going on with all these social services. So it was so very helpful to kind of get some outside eyes coming in to really look at things and just do a deep dive and see what's going on. So when we got that report back, I mean, I knew it was bad, but I had no idea it was really as bad as it was. So when we get the report back, we have, so we'll just start with workforce, because to me it's kind of a simple place to start there. We have a workforce system, and there's 10 different state boards across the state. So the state's divided up into 10 different chunks, and each one of these boards get to decide what they want to do with the money. So, sometimes two people say, we get federal tax dollars. Oh, it's just federal tax dollars. It doesn't matter how we spend federal tax dollars. We don't do that. Well, my word, we're like $38 trillion in debt. It is very important how we're spending our federal tax dollars. And sometimes I think there's that disconnect. Well, it's not state tax dollars. It's not state general revenue. It's federal tax dollars. So anyway, I don't share that view. I think it's very important. Every dollar is important. So when we got the report back, we find out that from this federal government, or in the state of Arkansas, we get $15 million for these state boards to divide up, plus another $5 million from WIOA. So we'll say it's around $18 to $20 million they get, and it's divided up between each one of those state boards. And so of that $20 million, 1.8 was spent on training 1,244 people. Nearly $20 million. It's like I'm like, what? Are you kidding me? And so
Definitely.
there's like we'd go to workforce centers, there'd be 20 employees, and they maybe see 5 people a week or something, which is crazy, so inefficient. It was really, just totally out of date and just not where we need to be spending our money. So, that was the first thing that we tackled, visiting with Cody Waits and Hugh McDonald with the Department of Commerce, who are the ones that had that. And so they were already looking as well, but the audit gave them an incentive to do even what they had already talked about, right? So what we're going to do now, which some other states have done, is take, instead of
Let
15
me
different boards. Yeah, go ahead. Go ahead. I'm sorry. I get talking too fast, but I'm excited what they're
I
doing.
say,
Yeah.
let me just repeat that. I want to be sure we don't. No, there's a
Sure.
little bit of lag between us actually.
Yeah.
But I just want to be sure that people heard this, right? If you're getting $20 million in workforce funding, we're only training using a tenth of that money to actually train people. So this is
Right.
not the focus of what we're doing. Is that right? The rest of it's going towards what?
So the
Overhead,
rest of it, sure,
maybe?
overhead, yeah,
Administration?
administration, salaries of those employees, building brick and mortar buildings and things, and so there's little programs that everybody's running. So, unfortunately, it feels like we have case managing programs and not managing people, right? So if you have that much money and you're only training 1,244 people, then you've lost it, and 80% of that was getting a CDL license. So to me, which is fine. CDLs are good, but there's a whole lot of other things going on in our state. And so what frustrates me is because we know there's things going on
So many
everywhere.
options.
So, oh my gosh, like never before. There's more options for our kids than there has ever been before. We've done so much with Learns and with Access, and there's so many new businesses coming to our state, one of the top states for job development. So we have opportunities everywhere. But if people don't know about them and they're not getting trained for them, what good is it doing? The people that we really need to be training are not getting trained. So that was the deal. So again, $20 million, 1.8 spent on training, 1,200 people, and the rest of it's just for administrative costs and overhead, which is pretty much what we see in government a lot of times. Unfortunately, we want to talk about D.C., but it was right here in Arkansas. So thankfully, we have administration that's ready to make some good changes. So when we visited with Hugh and them, and so they had already decided we're going to go to a one-state model, which they did in Utah like 30 years ago. And thankfully, we have a federal government that's on board, right? It's important that you have federal partners too that are willing to make some changes. So the federal government's saying, hey, the system's broken, let's fix it. You guys, the states come up with some ideas, and so they're really open to us making some changes. So big changes, we're going to go to a one-state model, which will allow us to focus in on training, and we can still have regional areas. So they're still going to divide up into 5 different regional areas, but we'll be able to decide what training needs where and be much more flexible, because things change all the time. Jobs are changing, new opportunities are coming in. So when those new opportunities come in, we can be more flexible and get the training done that we need to. So I'm really excited about it. So my vision, again, we are tasked in our subcommittee to come with recommendations in October. And then we'll look at those recommendations, come forth with legislation for January. So, my dream and my idea is what would it be like if in every single county, because right now we have a DHS office in all 75 counties. So if a family's in crisis, the first thing they see is we can get you on SNAP and Medicaid and we can help you with this and that. But there's nobody saying to you, hey, how can we help your family move forward? How can we help you get a job? Do you know about this education that's available? Do you know about this training that's available? And, if we don't have that connection there at our local DHS offices, really we're doing things for compliance. We're checking our little box. Yeah, we told them about that, but nothing's really being followed through. So if we could take some of these folks that are in our DHS offices, because we could cross-train them. We could put somebody from workforce in that office so people know about what's going on. So when folks come in crisis, we can help them with that immediate crisis, but then move them towards sustaining themselves and say, do you know about this program that's available? Actually help people get a job, because we have so much going. If you think about it now, our lottery scholarship now can be used on workforce training, can be used on things like welding and that, which it couldn't be in the past. So it can be on those areas. So we have Pell Grants available for workforce. We have so many more things available. We have so many free things available that we didn't have before, but we need to have people in each county that knows what in the world is going on in that area, what training is available. What's your local community college doing? I mean, you could I live in Perry County. If you can get over to Morrilton, which is just 20 miles away, that 2-year college is doing amazing things where you could take 9-month training and have a great new job. So there's a lot available, but there's been a total and complete disconnect because just no one's even thought about it, right? So there is, anyway, but lots of things are going. So is that going to happen? I don't know, but we're still working on some good things that we can move forward. We're giving some options. We're going to sit down and discuss what options can we do, and just putting more, there's so much going on online too. I want to say that we have so many things. Arkansas has done a great job developing Hope Hub that we have, right? So the governor's 1033 plan, which I hope folks know about, what she's doing with our 1033 plan of really getting all of our counties together, bringing in law enforcement, education, DHS, everybody, and get case managers to help people walk through and do some new things. But in all of that, we established the Hope Hub, and on the Hope Hub is different connections to what's online with launch, what's available for training, so you can find out what jobs are available, training is available. But we have to have people walk people through that, right? So if you're in the middle of a crisis and you just had some domestic violence situation, you've got two little kids, that's not the time for you to hear about that, right? But we need someone that can connect with that person, help them walk through a tough time, and then lead them to where they can get some child care and get some training and move them forward and set up some good guardrails. We have churches out there that want to do a great job, but if you're not really connecting with folks and helping them move forward, you're almost enabling the whole situation, right? Because if you're just doing, and I love people and I love their heart, but sometimes if we could all get
Yeah.
connected and work together and help these families out when they need it, and know that we put some guardrails up to make sure those people are really in need and this will really help them moving forward. I think that's the answer. So it's really just getting folks connected. We can do a lot of it online. There's so much that we can do online right now without even having a person to go anywhere. I'm so excited about getting in the 21st century, right, and actually getting people trained and moving them forward. So, yeah. And I'm sorry I get talking so fast, but I
Yeah,
really am
and I
just
think that
so
1033
excited about it.
program really brings. You're so excited. I love it. I think your excitement comes through. It's fantastic. But that 1033 program really brings in the community, right? It says
Oh,
that there
yes.
are already community resources available,
Mm-hmm.
and let's work with those community resources to help people get what they need. And who better to help you than your own community, right?
Exactly
And to
right.
know what's
Yeah,
available. I think that's a
exactly.
great program. So
Yeah.
let me ask you this. So if you talk about the system and you're basically saying you'll have one caseworker who could potentially help someone with SNAP, with Medicaid, with workforce training, that they're not having to
Mm-hmm.
go over here to this office to talk about SNAP and over here to talk. Is that
Right.
kind of what you're saying?
Yeah,
Could be the
exactly right.
model for
Yeah.
Arkansas?
Right. And so you can it's like right now we have
And
a
then
wide open door. Yeah, we have a wide open door to services, but we don't have a wide open door to work. And work is good, right? Work is healthy for you. Work is good for your family
yeah,
financially. It's good for you socially. It's good
this
for
is
your
good.
mental health. It's just so many positive things about work is a good thing. And so I think we need to, okay, and addressing that, how can we get families better off, right? We know that there's some folks that are disabled, they're elderly, and those that, this is not what we're talking about, but there's plenty of folks in Arkansas. In fact, we know there's at least 200,000 that are able-bodied working age adults that aren't working, and why. So how can we help their families get out of poverty and actually move forward? So, but each community is different. And that's why I love the 1033 plan that the governor did based off of Luke 1033, because we can get the whole community together. There's different things happening all over the state, but each community have one person there. We know what's going on, and we can connect folks. I just think it's a great idea, but this is really will helpful to make, so if we can get our part, our state part going, that'll make what's going on in the community even more efficient, right? So we can make sure that we're getting everybody organized and there is one system that knows what in the world's going on that people can connect to. So, yeah.
Yeah. So let's talk. You mentioned the Utah program, and Utah has been doing something similar to this. I think it's the only state in the country, right, that has
Mm-hmm.
kind of gone to this really radical change in the way that we look at social services and workforce training. So, do you have any data from, or any just kind of qualitative data from Utah of how long they've been doing it and how successful it's been, or what the feedback has been as we look at implementing that here?
Yeah, sure. No doubt. Actually, Utah put this into place 30 years ago. So 30 years ago, they decided they wanted to do something different and really make our Utah work first. So when you come through the door, the first thing they're asking about is work. And then if you need help, do you need help with TANF? Do you need help with childcare? And so the needs of the social services come behind to bolster what you're doing as your family, moving your family forward. And so as a result, Utah has had for a long time, for over a decade now, they've had the highest workforce participation rate in the nation. So they have more people working, and they have the lowest number of people per capita on Medicaid. So to me, that's all I need to see. That they have the lowest number of people on Medicaid, the highest number of workforce. And then, you and I get to go to one of our favorite conferences every year at ALEC, and ALEC does a rich states, poor states survey every year, and Utah's been on the top of that for 20 years now. So, it's just really, I mean, the evidence is
I
different there that
know
it's
it
working. It's
kills me.
making things forward, yeah. And I will say the federal government has not allowed other states to do that. So I don't want to misconception that we haven't, but we have a. It's really important to understand we have a very important window right now that we have a federal government that's very in favor of these changes, where in the past they have not. They actually shut the door after Utah did what they did. So we have an opportunity now. We don't know what's going to happen in the future. So I think I'm really adamant that we try and do what we can now before anything changes. So we have a federal government in favor of it. We have great data to show that it's working. I think it can really put a workforce motto and really help our Kansas move forward for the first time in a very long time.
So I'm curious, and you may or may not know the answer to this, but with the success that we're seeing out of Utah, why is the federal government not on board? I mean, it has not been. It sounds like it's open to it now, but in the past, why has it not been on board with changing this across states? It seems like it would save money and it could help people. These are both good things.
Sorry, I can't explain to you the federal DC at this point. I have no. It's crazy. There's absolutely, I don't know.
Well, I mean, who can?
Everybody loves their little program. Don't
Yeah,
mess with my little program. My little program is great, and it's change is
yeah,
hard. People don't like change, and we're seeing a little
that's
resistance even
probably right.
here. That it's just easy to stay. This is my little groove, and I'm doing a great job. And don't mess up my vacation. Don't mess up my program. I love my little program,
Yeah,
and leave it alone. So but unfortunately, we can see. I mean, we're not the only state, so don't think that Arkansas is the only one that's seeing these kind of results. It's across the board. But I'm excited that we have an administration here in Arkansas that's really ready to make some changes and ready to do a better job and get a better return on investment and get more people to work and get families successful. That's what we want. It's just so good for people's health. Make it go on and on the benefits of work. And it's just, I'm ready to see more Arkansans head that direction. I think some people just look around and have no idea what's going on, so they get really frustrated and they just give up, right? And so I think that's a part of it. And then, I'm not going to say that
yeah.
people aren't using the system. Yes, there are people that are using the system that milk it all they can, but that's not the majority by any means. I think if we can do a better job of it, we'll see more people getting
Yeah.
to work. And then, with the one big beautiful bill, that's really the perfect time because now we have work requirements on SNAP and on Medicaid. To me, it's the perfect opportunity for us to make some real changes because what's happening now with SNAP ENT training, only like 1% of people on SNAP are getting training. It's really not a good system. So we really need to connect our DHS office with SNAP ENT to workforce to actually get some people, some opportunities. And I think it's just the perfect time to get it done.
Yeah, I agree. And then, with the federal cuts, I think it's more and more important that we are
Mm-hmm.
using our dollars so much more efficiently than we have in the past. And I do appreciate the governor and the secretary being willing to look at and explore these bold changes
Mm-hmm.
because they
Yeah.
are pretty significant.
Yeah.
But
There.
if it can do more for people, I think that would be great. And I agree with you. I think work is an amazing thing. I always point to the Old Testament where it talks about, in the Bible where it talks about when you harvest your field that you leave some, right? So
Mm-hmm.
that the
Yeah.
widows and orphans can
Mm-hmm.
come and they can glean what's left
Mm-hmm.
because they're working, right? It's still a
Yeah.
handout. I
Right.
understand it's a handout, but they're working for it. And there's something that's
Sure.
good in your soul about
Mm-hmm.
working and feeling like you provided instead of, that's not how we're built. We're built to
Yeah.
kind of take care of ourselves, and whatever we can do to help people get to that point, I think
Mm-hmm.
is critical. So let me ask you
Yeah.
this, Mary.
Yes,
I'm
Mindy.
never out of questions. So, um, your subcommittee, it looks like your subcommittee is going to come up with a recommendation ahead of our 2027 session.
Mm-hmm.
Are you going to be like one big package? Are you thinking there are baby steps that we'll take along the way? Like, what do you think that will look like?
You know,
Excuse me.
well, some of it's not even require legislation. Some of it be executive branch to do their part. But yeah, we'll be coming up. I think with one big bill to
Okay.
really to hit what we want to do. But one thing I want to bring up too, Mindy, I meant to talk about was we with the one big beautiful bill, there's some serious fines coming to Arkansas if we don't get our error rate down on SNAP. And so in Utah, because they're combining all this and all the data is together, they're not subject to any fines. They're way below the error rate where they have been for years, decades, below the error rate because they have so much communication going on and getting all the data is right there. They've done a great job. So their SNAP error rate's below norm, and they have no. But if we don't fix our SNAP error rate, we're going to be spending $54 million on fines if we don't get it fixed. And so to me, it's another way for us to help get a better job. Excuse me, definitely a better way for us to get rid of our error rate is by using what this program in Utah has done.
Explain what a SNAP error rate is. I don't think most people know what that
Sure.
means.
Sure. So right now, when someone comes in to apply for SNAP, their income has to be determined that this is the amount of money they're making, that these amount of people do live in their house, and so it's usually income. People live, where do they live and do they work? How much money are they making? So it's those kind of things have to be. So sometimes, it's a lot of paperwork. Sometimes it gets filled out incorrectly by the caseworker. Sometimes it's by the person themselves that they're not verifying it. So error rate is just someone didn't cross their T's and dot their I's correctly, and the error's been, and some people, unfortunately, there are people out there trying to scam the system, and so it's really important that we get all the data correct and make sure that those people that need it are getting it, because when we waste dollars, then we don't have enough for those that really need it. I think it's really important to make sure so I appreciate what the federal government's doing to cut down on our error rate, because to me, tax dollars are valuable, and we paid for them, and we should not just be throwing them to the wind. I mean, all the fraud and stuff that we've seen across the nation makes me livid, honestly. I mean, it's just so much of it. So I think I appreciate what the federal government's doing on that, but we do, if we don't get our error rate below 6%, then we'll have to pay a certain amount back to the federal government. And so right now ours is 8.4, I think, is where it's at now. So to me, this is kind of a win-win, right? We're decreasing our error rate, we're saving money there, and we get people working. So
the error rate is not just fraud, right? It can be mistakes, it can be input error, but it also does encapsulate fraud. So there's a lot of good reasons to attack this.
Exactly right. You're exactly right. It can just be a complete input error on either part. It could be on the person that gave that caseworker the information, or it could be the caseworker. Either way, but it could just be simple error that direction. So, because there's a lot of rules in there that make sure that, yeah. So, yeah.
We look at this reform. Let's say we get these reforms implemented through executive order, and we pass whatever legislation needs to be passed to make sure it can be done. What are the measurements to make sure that we're achieving what we think we're achieving? Is it just more people being trained? Is it what will that look like as you try to measure these changes?
Sure, we have, our workforce participation rate is a great that we can look at, is how many people are actually working in our state. That's one way that we can look at it. And I think with this, we'll be able to track who's actually moved forward and who's actually has got a job. And we can look at it by the income data. So we can look at 6 months later, a year later, are these people working? How much money are they making? So we can track things that way. There's so much we can track data-wise. So we can see these families are actually moving forward. And hey, wouldn't it be great if we had less people on SNAP? We had less people on Medicaid, because their income's increased and they don't need it anymore. If we look over there where Nucor Steel is, right, where that went into that county, I mean, the SNAP rate over there has dropped dramatically because people have gotten to work. So I think we'll see a decrease in what's going out. So I know we have some people that are concerned about this, that we're trying to get more people on Medicaid and SNAP and on welfare. This the exact opposite. What we're trying to do is get people to work and people off permanently to where their families are stable, and life happens, right? Some things happen in life and people need some help. And I think that we should be there, but we should do it in an effective and a good manner, an effective and efficient manner where actually people were getting the help they needed. So, in a timely manner too. So, I think, Senator Dismayan loves to.
I think that's
yeah. Go ahead.
Yeah. No, go ahead. Nope, tell me.
I was going to say that there's been so many studies done on just hope. When people have some hope, they can actually move forward. And when they lose hope, they just get despondent and they just give up and quit. So I think we can just really get the word out on this, and people actually seeing their neighbors doing better. I mean, word like that travels pretty fast. So I think we can really instill some hope in a lot of people that have just given up.
I think that's very exciting. It's exciting to think about coming around people kind of in that 360 wraparound and helping them with not just here's money, good luck to you, but like here are ways I can give you money now because that's your short-term need, but then your long-term need, we're also going to help you meet that as well. And I think it's an amazing idea. Last question, then I really will wrap up because, lots of questions. When can we expect your report, and what do you see as a timeline as getting this implemented?
So October is when it's due. The legislation required us to have one by October. Now we'll probably have a preliminary report in October, and then I'll have another one. I will hopefully start in January. And so I'm hoping that we can get some things done on the executive branch beforehand, and then in January we'll get some legislation passed. But sometimes rules take a little while, so I'm not going to hold my breath. But with so much going on the federal level with with work requirements and with error rate, I think we'll see a quick implementation of what we do moving forward. And, we can start out, with, of course, there's some things that will be easier to do. I'm sure those will be handled quickly. I know I've seen DHS and them work on things even before we get the rules started because they know they're moving forward. Yeah. But I'm excited about that. So
that is fantastic. Well, Mary, before I let you go, is there anything that you need? Any ask that you have? Is there any summary you'd like to give before we wrap it up?
Oh, goodness, that's a good question. I just, I appreciate you helped me get the word out because nothing is passed by one person. We need 51 legislators to agree to what we're doing. And I know that in Louisiana that they started this last year and they had like no votes on either side of the aisle. Wouldn't that be cool? I think it'd be great for us to have no votes. So
Yeah.
we'll see if we can achieve that in Arkansas. But I just really we need legislators informed about what's going on. And if we have folks that have some ideas, my email is really available on our my ArcLeg email is very easy for somebody to get when we go on our ArcLeg website. Happy for them to reach out to some ideas because as constituents usually solve all the problems for us. So if somebody has some ideas they want to shoot my way, I'm more than happy to listen. So would love any input that anybody would have to share. Any ideas you think that might make us better? We'd love to hear them.
That's awesome. Hey, Mary, thank you so much for being here today and for sharing this. I think it's amazing information, and I think it's pretty exciting as we look at what it could look like in Arkansas in the next couple of years.
Awesome. Thanks so much, Mindy. I appreciate your time. Have a great day.
You too. Take care. I hope you've enjoyed hearing from Mary Bentley. Again, she's the co-chair of the Hospital Medicaid and Developmental Disabilities Studies Subcommittee for the Arkansas House, and she's doing a lot of work with her committee on workforce and social services. And that's what we talked about today. We talked about how do we get people out of poverty? How do we change this fragmented system that we have where if you need help, you have to go to one office to get workforce training, another office to get your SNAP benefits, and another office to get your Medicaid benefits. And it's hard to navigate that system. And so what they're talking about with this study that should be coming out in October is changing that system to a full wraparound system where you can go to one office and that one office can then help you get all the different services that you need, or at least connect you to those places. And it works within the governor's 1033 that she set up last year, which basically works with the community resources that are already there, whether it's through a church or through a nonprofit, and working with those resources as well, so that you're working with people in your community to help you get what you need. I think it's a fantastic idea. Utah has seen it very successfully for the past 30 years, and I think it can save Arkansas a lot of money, make our money go further. I think it will help people get onto workforce. It'll help them get the needs and get the needs met that they need met, but also give them that long-term hope and stability that I think is missing right now. So anyways, it is fantastic. I look forward to the study. As Mary mentioned, go to the ArcLeg website and grab her email if you have any questions or ideas for her. And I hope you'll join us again. Thanks.